All right, there are a few injuries that we can discuss dealing with the wrist joint musculature or structures of the wrist joint. And one area is called epicondylitis. Anytime you have itis, it's kind of an inflammation. And we have lateral epicondylitis and medial epicondylitis. Lateral is sometimes called tennis elbow and medial golfer's elbow. And again, if you remember, the lateral epicondyle of the humerus is where all your extensor muscles start from. So if you have repeated activities with a lot of extensor activity, wrist extensor activity, then those muscles may be overworked and they're all pulling on their insertion point, the lateral epicondyle, and it may be get inflamed. So tennis elbow, the idea is you're doing, say, with your backstroke, it would be an extension of the wrist, and you would get quote unquote tennis elbow from you overuse of the muscles that attach to the lateral epicondyle of the humerus. Those muscles are wrist extensors. Medial epicondylitis, golfer's elbow, comes from activities with repetitive flexor activity, flexor activity, because most of the wrist flexors are attached to the medial epicondyle. So that's kind of where these colloquial names, tennis elbow and golfer's elbow, come from. It's overuse of the muscles that attach either on the lateral side or the medial side of the humor. So overuse of wrist extensors on the lateral side or wrist flexors that attach on the medial epicondyle. And just to look at this image, we have the lateral epicondyle, right? You have your extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, all coming off this attachment site, and that can lead to tennis elbow or lateral epicondylitis. The medial epicondyle has most of the wrist flexors. They're on the anterior side, and that can lead to medial epicondylitis if you have excessive wrist activities that use excessive wrist flexors, sometimes called golfer's elbow.